The arm was already dead. That's what Dr. Marcus Holt told the room, loudly, confidently, the way men like him always speak when they've already decided the outcome. The patient on Gurney 7 had 30 minutes, maybe less, before they'd be cutting at the shoulder joint and calling it a mercy. Nobody was looking at the nurse in the doorway. She was holding a medication tray, maybe 29, 30. Quiet eyes. The kind of person a busy ER swallows whole without noticing. She'd been at Riverside General for 2 years, and most of the senior staff still didn't know her name. Then the soldier on the gurney, pale, bleeding, barely conscious, turned his head and saluted her. If you've ever been underestimated, overlooked, or pushed aside, stay with me until the very end. Drop a like and tell me in the comments what city you're watching from. I want to see how far this story travels. The storm had been building since mid-afternoon. By the time it finally broke over Caldwell, Oregon, sheets of rain hammering the windows of Riverside General Medical Center, lightning cracking the bruised sky in two. The emergency department had already been running hot for 6 hours. 3 car accidents on I-84. A construction site collapse that sent 4 men in before dinner. A teenager with a nail through her palm who kept insisting she was fine. The kind of Tuesday that reminded the nursing staff why they kept ibuprofen in their locker and silence on their drive home. Mara Sutton had learned a long time ago not to wish for a quiet shift. Quiet meant you had time to think. Thinking meant remembering. And remembering, well, that was the part she'd been managing to avoid for almost 4 years now. She moved through the department the way she always did, efficiently, without calling attention to herself, her sneakers nearly silent on the linoleum. She was 31, with dark hair pulled back tight, and the kind of posture that said she was used to carrying things alone. The nurses who'd been at Riverside longer treated her politely, the way you treat a piece of furniture you've decided not to move. She was there, she was functional, and she didn't require much conversation. That was fine with Mara. She'd chosen this hospital, this shift, this particular corner of a city she had no history with, for exactly that reason. She'd picked somewhere she could disappear into the work. It had been going pretty well, until Gurney 7 came through the ambulance bay doors at 9:14 p.m. She heard it before she saw it, the kind of controlled urgency that separates a serious trauma call from a minor one. Not shouting, because good trauma teams don't shout, but voices clipped and tight, movement purposeful, the beeping of equipment that had already been running for longer than anyone liked. She was coming out of exam room 4 with a medication tray when the doors burst open and the paramedics rolled him in. Male, 30s, military haircut, close to the scalp on the sides, though he wasn't in uniform. Just civilian clothes, dark pants, and a shirt that had been partially cut away by someone who'd already been working on him in the field. His left arm was wrapped from elbow to shoulder in a field compression bandage that was doing a poor job of hiding how bad the swelling had gotten. The color of the limb was wrong. Even from 10 feet away, Mara could see that. The kind of pallor that didn't come from shock alone. The paramedic giving the handoff was a compact woman named Reyes, who Mara recognized from previous shifts. Steady voice, no wasted words. 34-year-old male, Captain Daniel Rourke, found unresponsive at a private airfield outside Caldwell approximately 40 minutes ago. Multiple contusions, suspected blunt force trauma to the left arm and shoulder, possible crush mechanism. Details are unclear. The scene was locked down fast. Pressure's been dropping. GCS was 12 in the field, now a 9. Left radial pulse is absent. How long without distal pulse? That was Dr. Holt, already at the gurney, already pulling at the bandaging. At minimum 90 minutes from estimated injury time. Marcus Holt was the kind of doctor who filled rooms. He was 53, broad-shouldered, with silver hair he wore like a credential, and a voice that made interns forget how to breathe. He had a wall of commendations in his office, and a filing cabinet full of incident reports that had, somehow, never quite stuck to him. He was the trauma chief at Riverside General, and he carried that title the way some men carry a weapon, visibly, at all times, pointed slightly at everyone around them. He examined the arm for 45 seconds. 45 seconds, and then he straightened up, and the decision was already written on his face. Vascular necrosis is progressing. We've got 30 minutes before this crosses into non-salvageable territory, and I'd argue we're already there. He looked at the senior resident, a lanky young man named Park, who was doing an admirable job of hiding his uncertainty. "Get ortho on the phone. We're prepping for a proximal amputation." The word landed in the room the way those words always land. Not loudly, but heavily. A shift in atmosphere. The interns exchanged glances. A nurse at the supply cart stopped moving for a half-second before catching herself. Mara had stopped walking. She was still in the corridor, medication tray in both hands, close enough to see the patient clearly, close enough to see the arm, the actual configuration of the swelling, not just its color. The bandaging Reyes had applied in the field was a standard arterial compression wrap, applied correctly for arterial hemorrhage. Standard protocol. The right call if this was an arterial bleed. But something about the shape of the swelling was wrong for that. She stood there, and she shouldn't have been looking as closely as she was, and she knew that, and she kept looking anyway. It was the distribution of the edema. It wasn't tracking along a vascular path the way a crush injury with arterial compromise typically presented. It was more compartmentalized, more lateral, and the shoulder itself, she could see now that the shirt had been cut away, showed bruising in a pattern she had seen before. Not in a civilian ER, not in anything a textbook had prepared her for. She had seen it on a mountain in a country she was not supposed to name, at 2 a.m, with mortar fire close enough that the ground was shaking. She pushed the thought away. Hard. She turned to go finish delivering the medication. "No." She stopped. The voice had come from Gurney 7. Rough, like speaking through gravel, like a man running on reserves he'd already been spending for an hour. She turned back slowly. Captain Daniel Rourke was looking at her, not the way patients usually look at nurses, seeking reassurance, or help, or simply the nearest human face. He was looking at her the way you look at someone you recognize, the way you look at someone when recognition itself is a kind of alarm. His right hand had come up, the one still working, and he'd brought it to his forehead in a salute that wasn't fully crisp. He didn't have the strength for crisp, but it was unmistakably, precisely a salute. Not a gesture, a salute. "No," he said again. "Not you." The ER had not gone completely silent. It had gotten quieter in that specific way. Large spaces get when something unexpected happens in a corner of them. Conversations dropping half a register, movement slowing slightly. Holt looked up from the chart he'd been scrawling on. Park looked at Rourke, then at Mara, then back at Rourke. Mara hadn't moved. Her face had done something, controlled itself in the way of someone who'd practiced controlling it. But for just a moment, just a fraction of a second, something had flickered behind her eyes. Something that looked a lot like fear. "I'm sorry," she said. Her voice was quiet, steady. "I think you've mistaken me for someone." "Sutton." He didn't say it like a question. He said it like a file number, like a fact. "Sergeant Mara Sutton." The medication tray was still in her hands. She was holding it very carefully. "I'm Nurse Sutton," she said. "You've had a serious injury, Captain. You need to let the doctors. You need to look at my arm." "That's not... Please." The word came out stripped of everything except what it was. Not a command. Not the voice of a man who is used to asking for things. Just, please. With all the weight of someone who'd run out of other options. "Sutton, look at the arm." Holt had been watching this with the expression of a man who'd been inconvenienced in his own house. He capped his pen. "Nurse?" He glanced at someone nearby. "What's her name?" "Sutton," Park said. "Nurse Sutton." Holt's voice was the patient version of his normal voice, which meant it was condescending at a slightly lower volume. "The patient is disoriented. GCS 9. Significant blood loss. He's been hypoxic. Whatever he thinks he recognizes, it's the medication or the blood pressure talking. Please finish your medication round and let us work." She looked at Holt. She looked at Rourke. Rourke was still watching her. His color was terrible. His lips had a grayish cast to them that she didn't like. But his eyes were clear, unnervingly clear for a man with a GCS of 9, which meant Reyes' field assessment had probably been conservative. He was tracking. He was present. He knew exactly who he was looking at. "Okay," Mara said. She left. She delivered the medication to exam room 6. She logged it in the system. She stood at the nursing station for approximately 40 seconds, her hands flat on the counter, not moving, looking at nothing in particular. Then she went back. She came in from the supply corridor on the far side of the trauma bay, which meant she was coming in at an angle that Holt, who was standing at the head of the gurney dictating notes, didn't immediately register. She set the empty tray on a cart. She moved to the left side of the gurney, the arm side, and she looked. Not a glance, she actually looked. The ortho resident, a second-year named Torres, who clearly wished he were somewhere else, had begun removing the field compression bandage to get a better read before they called in the attending. The arm was exposed from mid-forearm to the shoulder, and Mara stood very still, and she looked at all of it. The swelling pattern was exactly what she'd suspected from the corridor. Lateral compartment, running roughly from the mid-humerus to the distal forearm, but the distribution wasn't consistent with arterial occlusion as the primary mechanism. The bruising on the shoulder was deep and already purpling toward that specific shade that indicated significant force applied over a limited area. Not a crush, not a fall, but something more like a high-impact compression event. The kind of thing that happened when a human body got caught between two surfaces moving toward each other at speed, or when something heavy landed with precision, or when a load-bearing structure failed in a very specific way at a very specific point. She knew that injury. She knew it in her hands before she'd finished thinking it. "What are you doing?" Torres noticed her first. He wasn't hostile, just confused. She wasn't assigned to this case. "Looking." "She's not cleared for this case," Holt said, without looking up from his dictation. The voice of a man accustomed to not needing to look up. "Nurse Sutton, this is the second time I'm asking you to step back." "The diagnosis is wrong," she said. Holt looked up. The room did that thing again. That specific quiet. He took a moment. The moment was deliberate. It was the kind of moment that was its own message. "I am choosing to remain calm, and that restraint is something you should feel grateful for." "I'm sorry?" "The primary mechanism isn't arterial occlusion." She kept her voice level. She was not performing calm. She was actually calm, in the particular way of someone who had been genuinely terrified before and knew the difference. The swelling pattern is compartmental, not vascular, and the shoulder bruising is consistent with high-impact compression, not crush injury. "I think there's an acute compartment syndrome, secondary to a—" "Nurse!" Holt said it the way you say a word when you want it to stop a conversation. "I have been a trauma physician for 22 years. I have assessed this patient. The limb is non-perfused and has been for well over an hour. The decision has been made." "The radial pulse is absent," she said, "but that doesn't mean—" "Thank you." He turned to Park. "Get security, please, and get ortho attending on the line. I want them here in 10 minutes. Park looked like he'd rather be literally anywhere else. He didn't move immediately. "Dr. Holt," Torres started. "Doctor? Torres, you're a second-year resident, and I'd appreciate it if you remembered that." Holt moved around the gurney toward Mara. He stopped about 4 feet away, which was close enough to make the point. "I don't know what you think you saw from the hallway. I don't know what kind of personal history you have with this patient that makes you think it's appropriate to walk into a trauma bay you weren't assigned to and contradict the attending's assessment in front of—" "She saved my life." Rourke's voice had gotten stronger. It had no business being stronger. He'd been declining for the past 20 minutes by every metric they had. But it was. Clear and flat and carrying. Holt turned slowly. "She carried me," Rourke said. He wasn't looking at Holt. He was looking at Mara. 11 kilometers, under fire, with a dislocated shoulder. A pause while he managed his breath. "I was 190 pounds of dead weight, and she didn't drop me. I'm trusting her now more than I'm trusting you." The silence this time was a different quality. Holt's jaw had tightened. He was doing the calculation. The patient's status, the audience, the optics of what was currently happening in his trauma bay. "The patient is disoriented," he said, to no one in particular. "Chart it." "I'm not disoriented." Rourke's hand moved, reaching out. Not quite reaching Mara's arm, but reaching in her direction. "Look at it again. Whatever you think you saw." She was already looking. She'd never stopped looking. The thing she was seeing was The thing she'd been trying to find a way to articulate in the language of a civilian hospital, in terms that a trauma chief would hear, was something she'd been taught in a very different kind of classroom, by a very different kind of teacher. She had learned how to read battlefield trauma not from a textbook, but from 2 years in environments where getting it wrong meant watching someone die in your hands. She had learned what compartment syndrome looked like when it presented in a compressed timeline. She had learned that absent distal pulse did not automatically mean dead tissue, that it could mean the circulation was trapped, not absent, that the difference mattered, that the difference was sometimes an arm, sometimes more. "I need a pressure manometer," she said. "You need to leave my ER," Holt said. "A compartment pressure reading," she said, as if he hadn't spoken. She was looking at Torres, at Park, at the nurses around the edges of the bay who had been watching all of this with the particular expression of people who wanted to intervene and didn't quite have the standing to do it. If the intracompartmental pressure is below 30 delta, below 30 below the diastolic, amputation is the wrong call. If I'm wrong, you lose 5 minutes. If I'm right, security, Holt said, and this time it wasn't a question or a request. He was looking at someone near the door. A young security guard named Whitmore, 23 years old and 3 months into the job, looked at Dr. Marcus Holt and then at the nurse standing at the gurney and then down at his shoes for a moment. Then he looked back up at Mara. "Ma'am," he said unhappily, "I'm going to have to ask you to come with me." She didn't move immediately. She was looking at the arm. She was doing math. Not numerical math, but the other kind. The kind where you weigh what you know against what you're allowed to say, what the evidence shows against what the room is willing to hear. She was calculating the distance between what she could see and what she could prove. Rourke watched her. "I trust you," he said. Just that. Mara stepped back from the gurney. She let Whitmore escort her to the corridor. She stood in the hallway outside the trauma bay and listened to the sounds of Holt resuming his assessment, Torres making a phone call, the low beeping of the monitors settling back into their rhythm, and she breathed. 1 breath, 2. Her hands were not shaking. That surprised her a little. She'd expected them to be shaking. 4 years ago, in a different life, her hands had shaken for weeks after she got home. She thought that was something that lived in her now, permanently, the way certain injuries leave residue, a tremor that showed up uninvited when the stakes got too high. But her hands were steady. She looked at them, turned them over once, looked at the ceiling. She had 8 minutes before Holt's ortho attending arrived, and they prepped for the procedure. Maybe 9. She knew, not from protocol but from experience, that once the prep team assembled there was a momentum to these things that became very hard to reverse. Park appeared in the corridor. He glanced back through the door, then at her. He was young, maybe 27, with the slightly dazed look of someone who'd spent the last 12 months trying to figure out the difference between what medical school told him and what actually happened in rooms like this one. "What pressure threshold?" he asked quietly. She looked at him. "Delta pressure under 30 millimeters mercury," she said, just as quietly. "Normal saline on standby if we're going to do a fasciotomy. And the shoulder, if I'm right about the mechanism, there's a proximal tethering point. You want to check. I can't run a pressure check without attending approval." "I know." He held her gaze for a moment. He was doing his own calculation. It was a harder one than hers because he had more to lose in terms of career and less to fall back on in terms of experience. She didn't envy him. "The patient's SAT has been declining," he said. "We'd have to hold for reassessment before prep anyway. Standard protocol." A beat. "That gives maybe 8 minutes." "I know," she said again. He went back inside. Mara stood in the corridor. She was trying not to think about the last time she'd made a call like this, the last time she'd looked at something and known what it was and said so, and what had happened after. She hadn't thought about Specialist Ryan Cass, and she'd been doing so well at not thinking about him. 14 months without the dream. Almost 8 without the specific waking ambush of his face at the moment she'd made the call to move. The moment she'd said, "Go," and he'd been covering, and the sound that came after. She pressed her back against the wall. Breathed. The monitors inside the trauma bay changed pitch. Not the alarm. Not yet. But the baseline note of them shifted, and she'd been listening to machines long enough to hear it. The patient's pressure was dropping faster. She pushed off the wall. She was already moving when the door opened and Park leaned out with an expression that had crossed some line past uncertainty into something closer to controlled alarm. His systolic just dropped to 81, Park said. He's going vasopressor. His compartment pressure, Mara said. Has anyone run it? Holt doesn't want... Has anyone run it? Park stared at her. No. Then someone needs to. She was at the door. Right now, before his pressure bottoms out and none of the rest of this matters. Inside the bay, Holt was at the head of the gurney, pushing medications, voice elevated, not panicking, but working efficiently and fast. Torres was on the phone. 2 nurses were managing lines. It was controlled chaos, the kind that looked calm from the outside and felt like falling from the inside. Rourke's eyes, when they found hers, were still clear, dimmer, but clear. "You're still here," he said, barely a voice now. "I'm here," she said. Holt spun around. "Get her out of... Run the compartment pressure," Mara said. Loud enough, clear enough, loud enough that everyone in the room could hear it and no one could pretend they hadn't. "If you amputate and I'm right, you've taken a healthy arm. Run the pressure. 5 minutes. If the delta is over 30, you do the surgery. If it isn't, you are a nurse in my ER, then document that a nurse requested the test and you refused," she said. "In writing, right now, with the patient's family and the hospital's legal team copied." She held his gaze. "Do it right now, and I'll leave the room." Holt stared at her. Torres had stopped talking on the phone. Outside the window, lightning hit close enough that the lights flickered. The backup generator kicked in with a low hum and the monitors stuttered and came back. In the half-second of dimness, in the strange clarity of the resumed light, the room felt suspended. Holt said nothing. And in that silence, Torres quietly set down the phone, picked up a manometer kit from the supply cart, looked at Holt with an expression that said, clearly, that whatever happened next he was going to be able to say he'd been part of running the test. Holt's jaw worked. Something moved through his face, not quite anger, not quite fear, but a cousin of both. 5 minutes, he said. It was not a concession. He said it like a dismissal, like he was granting a small, pointless request before the inevitable, like he already knew the answer and was simply managing the situation. Torres set up the kit. Mara moved to the bedside. Holt stepped back, not out of courtesy, but because the procedure required space, and he was calculating, always calculating. The needle went in. The number on the monitor climbed. And then it stopped. Mara looked at the reading. She looked at it for a long moment, very still, making sure she was reading it correctly, making sure her own hope wasn't distorting the number in front of her. Delta pressure, 22 millimeters of mercury. 22. 8 below the threshold for irreversible compartment syndrome. 8 below the number that would have justified what Holt had been about to do. Torres read it too. His face went very careful, very neutral in the way of someone carefully not reacting. Park had come to stand where he could see the readout. He looked at Mara. Mara looked at Rourke. Rourke's eyes had drifted, half-closed. His breathing was shallow. He was circling somewhere at the edge of consciousness, and she needed to move fast, but she needed one more second. Just one. "Captain," she said quietly, "I need you to stay with me." He opened his eyes, looked at her. Something like a smile crossed his face. Not quite, but close. The shadow of one. "Not going anywhere," he said. "Good." She straightened. She looked at Torres. "We need a fasciotomy, not an amputation. Medial and lateral incisions, release the compartment. And I need someone to check the proximal neurovascular bundle at the shoulder. There's a tethering mechanism. If we don't release that simultaneously, we'll decompress the forearm and just move the obstruction point." "That's," Torres started. "I know it's outside standard protocol. I know you haven't seen it presented this way." She said it without apology, without softening it, just fact. "But I've seen this injury before, and I know what happens if we miss the tether. Do you want me to walk you through it?" He looked at her for a moment. He was 28 years old, and he had never seen anyone talk in a trauma bay the way this woman was talking. There was something in it that didn't fit the context. Not arrogance, not recklessness, but a specificity that suggested experience she had no business having. "Yes," he said quietly. Walk me through it. Holt had not spoken in 30 seconds. That itself was a sound. His silence had a particular quality, dense with something she didn't want to examine too closely. She was aware of it the way you're aware of a held breath in a room. Dr. Holt, Torres said carefully, do I have your authorization to proceed? Holt looked at the manometer reading. He looked at it for a long time. Outside, the rain was hammering the windows. The backup generator hummed. The monitors kept their steady, diminished count of Daniel Rourke's heartbeats. Holt's mouth opened, and that was the moment the outer doors of the emergency department banged open. Not patients, not paramedics. 4 men in dark civilian clothes moving with the kind of deliberate precision that had nothing to do with medical urgency and everything to do with something else entirely. Behind them, a woman in a dark jacket with credentials clipped to her lapel that Mara recognized, not the hospital's credentials. Federal. They moved toward the trauma bay with purpose, and the nurse at the desk, who'd started to stand up to intercept them, sat back down when she saw the credentials more clearly. The woman at the front stopped at the glass window of the trauma bay. She looked in. She looked at Rourke on the gurney. She looked at the assembled medical staff. And then, slowly, with the particular attention of someone cataloging a scene, she looked at Mara. Mara looked back. Neither of them moved. Through the glass, the woman's expression said nothing at all, which meant it said everything. Inside the bay, the monitors shifted again. Rourke's pressure ticked down another point. Torres, Mara said without looking away from the woman at the window. We need to start now. Torres moved first. That was what she would remember later. Not Holt's silence, not the federal agents at the glass, not even the sound of Rourke's monitors doing their slow, grinding decline. What she would remember was Torres picking up the first instrument without waiting for Holt's authorization, his hands finding their position with the careful steadiness of someone who had decided, in a span of about 4 seconds, which side of this he was going to be on. It was a small thing. It was everything. I need the lateral incision guide and a number 15 blade, Mara said, pulling gloves from the dispenser with practiced efficiency. She did not look at Holt. She did not look at the window. She looked at the arm, at the shoulder, at the specific architecture of what needed to happen and in what order. A nurse, her name tag said Bryn, and she had been standing near the wall for the past 10 minutes with the expression of someone watching a traffic accident develop in slow motion, moved to the supply cart without being asked. Her hands were not entirely steady, but they were moving, and that was what mattered. Holt took one step toward the gurney. I have not authorized. The patient authorized it, Mara said, still not looking at him. His pressure is at 78 systolic. We have a window right now, and in 4 minutes, we won't. You are not a physician. I know what I am. She positioned herself at the lateral aspect of the forearm, reading the tissue architecture the way she'd been taught to read it. Not just visually, but with the particular attention that came from knowing how wrong it could go if you missed something. And I know this injury. I have released this exact presentation before. So you can stand there and watch, or you can scrub in, but I'm starting in 30 seconds either way. She heard his breath go short. The specific sound of a man whose authority was being tested in front of an audience and who had not yet decided whether to assert it or absorb the situation. She started in 28 seconds. The first incision was clean. She'd done this in conditions that made a trauma bay look like a controlled laboratory. She'd done it in partial darkness, in a forward operating environment, with equipment that cost less than the gloves she was currently wearing. Her hands did not shake. They never shook during the work. It was only after, in the quiet, that they remembered they were allowed to. Torres watched and assisted with the focus of someone who was genuinely learning something, which was a quality Mara had always respected. The ability to receive information without ego, to set aside what you thought you knew and look at what was actually in front of you. Park had moved to the shoulder, following her guidance on the proximal point. His movements tentative at first, and then increasingly precise as she talked him through the tethering release. Slight superior angulation, she said quietly. You're looking for where the fascial layer doubles. It'll feel like resistance that gives in 2 stages. I feel it, Park said. Don't force through. Let it present. Yeah. A pause. Yeah, I've got it. The room had reorganized itself around the work. That happened sometimes when the work was real enough and the politics evaporated, the hierarchy flattened, and everyone defaulted to their actual function. Bryn had found her footing and was managing the instrument tray with quiet competence. The monitoring nurse called pressures at 30-second intervals without being asked. Holt stood near the far wall. He had not left. That was the most interesting thing about him in this moment. He had not left, had not asserted control again, had not called security a second time. He was standing near the wall with his arms crossed and his face doing something complicated that Mara chose not to examine. Through the glass, the federal agents were still there. She was aware of them the way she was aware of the weather, as a condition, not a distraction. There were things she would need to deal with when this was over. Right now, those things lived in a compartment she had closed and locked. Releasing lateral compartment now, she said, for the room, for the record. Torres, I need you watching the color change in the distal tissue. Call it when you see it. Watching, Torres said. 30 seconds. 60. There. Torres's voice came out different. Not excited, but changed. Quieter, actually, which was the real tell. There's a color change, distal forearm. It's a pause. It's perfusing. Mara didn't let herself feel anything. Not yet. She completed the lateral release with the same focus she'd started with, checked her angles, looked at what she'd done from the perspective of what needed to come next. Park, she said. The tether. Released, Park said. I've got good visualization. The monitor cut through before she could respond. Not the alarm. The good change. The systolic climbing back up the ladder, one digit at a time, finding purchase. 78 to 82. 82 to 87. Slow and unsteady, like something dragging itself back to its feet, but climbing. The radial pulse, when Torres checked it, came back faint and thready, but present. Present. Torres looked at the Doppler in his hand like he wasn't entirely sure what to do with what it was telling him. Then he looked at Mara. There's a radial pulse, he said. I know, she said. She stepped back from the gurney. Her gloves were bloody. Not dramatically, but functionally, the way gloves get in real work. She stripped them and dropped them and let herself breathe, one full breath, the kind that filled the lower lungs and came back out slow. Rourke's eyes were open. They found hers the way they'd found her from across the room an hour ago. Directly, without hesitation, without the unfocused drift of a man who was losing the thread. His color was still poor, but the gray quality had receded slightly from his lips. He didn't say anything. She didn't need him to. Holt was still standing at the wall. She looked at him now. She hadn't needed to before. And she did not particularly want to now, but she looked at him because she'd learned a long time ago that not looking at things that were happening in the room was how you got surprised later. His face had settled into something she recognized but couldn't quite name. It wasn't shame. She didn't think Marcus Holt had the architecture for shame, not in the quick, clean way of it. It was something more like recalculation, the expression of a man who had expected one outcome and gotten another and was currently running fast backward through his options. The patient will need monitoring through the night, she said. To no one specifically. To the room. Compartment pressures every 2 hours. Radial pulse checks every 30 minutes. If the circulation compromises again, I know how to manage post-fasciotomy care, Torres said, but he said it without edge, the way you correct someone when you've just been deeply impressed by them. A reflex, not a challenge. I know you do, she said. She turned toward the door. The woman in the dark jacket was waiting in the corridor. Up close, she was maybe 45, with dark eyes that did a lot of work and the kind of stillness that came from years of being in rooms where the wrong movement at the wrong time changed the outcome. Her credentials were federal. Department of Defense, an office Mara recognized because she'd had clearance at one level below it for 2 years. That was not something she'd ever told anyone at Riverside General. Sergeant Sutton, the woman said. I go by Mara, she said. Or Nurse Sutton. She looked at the credentials. Agent Harmon. The woman didn't extend a hand. She had the posture of someone who'd made the deliberate decision a long time ago not to perform warmth she didn't currently have. Mara respected that. Vivian Harmon, I'm going to need a few minutes of your time. I need to document the procedure. The documentation can wait 10 minutes. It wasn't a question. Harmon had already half turned toward a family consultation room down the corridor, an invitation shaped like a statement. Captain Rourke's transport has been classified. There are aspects of his situation I'd like to clarify with you, given your history with the patient. Mara looked back through the glass at the trauma bay. Torres was already managing the post-procedure stabilization. Park was on the phone. Bryn was charting. The room was functioning. She followed Harmon. The consultation room was small and aggressively beige, the kind of space designed to be inoffensive to grieving people, which made it feel slightly surreal as a setting for what was clearly about to be something else. Harmon sat. Mara sat across from her. One of the men who'd come in with Harmon, broad, close-cropped hair, the specific bearing of a man who had done a lot of physical things over a lot of years, stood at the door without being asked. "You haven't been in contact with Captain Rourke since your separation from service," Harmon said. It was not phrased as a question, but it had a question inside it. "Correct," Mara said. "And you didn't know he'd be transported to this facility." "I found out when his gurney came through the doors, same as everyone else." Harmon looked at her steadily. "But you recognize the injury?" "Yes. A combat-specific presentation that your trauma chief of 12 years' experience did not recognize." "To be fair to Dr. Holt," Mara said, with no particular warmth, "it's not a presentation that shows up in civilian emergency medicine. You'd have to have seen it in a forward operating environment." A beat. "Which I did." "Which you did," Harmon said. She had a folder on the table that she hadn't opened yet. Her hands were flat on either side of it, just present. "Sergeant Sutton, your record prior to medical separation. You want to tell me how that reads?" "I know how it reads. Decorated combat medic. 2 deployments, 14 months operational. Field citations that your superiors described, and I'm using the exact language here, as exceptional beyond reasonable standard." She paused. "And then a classified incident in month 22 of your service that resulted in medical and psychological separation." The room got a different quality of quiet. "I'm aware of my own record," Mara said. "What happened tonight?" Harmon began. "What happened tonight was a misdiagnosis that I corrected. What happened tonight was a sergeant with classified field experience performing an advanced surgical intervention in a civilian emergency room." Harmon's voice wasn't harsh, it was precise. "Which raises questions about who you are, about why you're here, about what your status actually is." "My status is a floor nurse on the overnight shift," Mara said. "Or it was before tonight." Harmon looked at her for a long moment. Then she opened the folder. She turned 3 pages without showing Mara what was on them, then slid a single sheet across the table. Mara looked at it. It was a photograph, black and white, grainy in the way of surveillance or recovered footage rather than a planned image. A mountainside. Night or near night. 2 figures, one of them clearly supporting the other, moving across rough terrain at an angle that suggested controlled urgency rather than panic. Mara recognized the angle. She recognized the terrain. She did not need to look at the faces to know who the 2 figures were. "You know what this is?" Harmon said. "Yes." "The incident after this photograph was taken. I know what happened after this photograph was taken." Mara's voice had not changed. It was still flat, still level, still the voice of someone who had made a decision a long time ago about not letting certain things into her tone. "I was there." "Specialist Ryan Cass," Harmon said. There it was. Not ambushed by it this time. She'd known it was coming since the moment Harmon had said classified incident. Knowing it was coming didn't make it easier. It made it different. Knowing what was going to hit you and being hit by it were 2 distinct experiences, and only the first one gave you any real preparation. "I know who he was," Mara said. "You blamed yourself for his death." "I made a field call that put him in a position where he was killed. Yes." "That's not what the incident report says." Mara looked up. She hadn't meant to. She'd meant to keep her eyes on the table, on the photograph, on the neutral middle distance that she'd been using as an anchor. But she looked up. Harmon's expression hadn't changed. It was still that deliberate, watchful stillness. But there was something in it. Not sympathy, which would have been the wrong thing, but a kind of very sober acknowledgement. The face of someone delivering information they know will land hard, and who has chosen to do it clearly rather than carefully. The incident report from that mission was amended 14 months after your separation, Harmon said, based on recovered communications and testimony from 3 members of your unit who were initially debriefed under classified protocol. She turned another page. Did not slide this one across the table. Specialist Cass was not killed as a result of your call. He was killed covering a secondary extraction point that Command had failed to communicate was compromised. The breach of that point was a command-level intelligence failure, not a field-level tactical failure. The fluorescent light above them hummed. Mara was aware of her own breathing, aware of her hands on the table. She did not trust herself to look at the folder. She did not trust herself to look at anything except a fixed point on the wall past Harmon's shoulder, and she focused on it with the specific intensity of someone using concentration as a form of structure. That information, Harmon continued, was classified at the time of your separation to protect an ongoing operation. The classification was lifted 8 months ago. Mara said nothing. Your separation under psychological grounds, Harmon said. The record, it can be reviewed. I didn't ask for that. I know you didn't. That's not why I'm telling you. Harmon closed the folder. I'm telling you because Captain Rourke has been requesting a review of your separation record for the past 3 years. He filed the original petition 6 months after your discharge. He filed twice more after that. A pause. He has maintained consistently and on record that you were separated under circumstances that misrepresented what actually happened on that mountain. Outside the consultation room, the ER sounds continued their rhythm. Movement, voices, the distant steady beep of equipment that never fully went away. The storm had not abated, rain on glass, irregular and persistent. Mara finally looked back at Harmon. Why are you telling me this tonight? She asked. Because Captain Rourke listed you as his emergency contact 2 years ago, Harmon said, and because what you just did in that trauma bay. She let it sit for a moment. There are people who need to know what that looked like. What did it look like? Harmon held her gaze. Like someone who never stopped being what they were trained to be. Mara looked at the folder on the table. She did not ask to see it. She was not ready to see it. The words on those pages would require more space than this beige room with its humming light, more space than she had right now with the adrenaline still metabolizing in her bloodstream and the smell of the procedure still on her clothes. I need to go check on my patient, she said. Of course, Harmon said. Mara stood, moved to the door. The man with the close-cropped hair stepped aside without being asked. She was at the door when Harmon said, Nurse Sutton. She stopped, didn't turn. The 4 of us didn't come to Caldwell tonight just because of Rourke's transport. A beat. There's been a complaint filed against this hospital, against a specific physician, relating to a pattern of unnecessary surgical interventions over the past 18 months. Harmon's voice had taken on a slightly different quality. Flatter, more deliberate. We've been building a picture. Tonight added something to it. Mara turned then, slowly. How many? She asked. Harmon looked at her. The current confirmed count is 9 cases, she said. Procedures that, under review, appear to have been performed without adequate clinical justification. 9. 9 people. Mara's mind did what it always did with numbers that large, broke them down into faces, which was something she'd never been able to stop doing, a professional hazard that had only gotten worse with everything she'd seen. 9 people who had come to an emergency room in some version of the worst moment of their lives and been made worse by the person responsible for helping them. Rourke would have been 10, she said. Yes, Harmon said. He would have been. Mara went back through the corridor. The trauma bay had settled. Torres was writing notes. Park had stepped out, presumably to call someone. Bryn was charting at the station with the careful attention of someone who had decided to document this night in more detail than usual, which Mara noted and appreciated without saying so. She checked Rourke's vitals herself. The radial pulse was still present, still weak, but definitively there. His color had not improved dramatically. It wouldn't, not tonight, but the gray-blue quality of crisis had receded from his extremities. His systolic was holding at 92, which was not comfortable but was survivable. He was conscious. Barely, but there. You're still here, he said again. The same words as before, but different now. less urgent, more simply observational. The voice of a man noting a fact about the world. "Still here," she confirmed. He looked at her for a long moment, then with the deliberateness of someone working against both medication and exhaustion. "Harmon," he said, "she talked to you." "She did." "She told you?" "Yes." He closed his eyes, opened them again. "I've been trying to tell you for 3 years," he said. "I didn't know how to find you." "You filed 3 petitions." She kept her voice even. Not cold. She was not capable of cold with him. Not now. But measured. Because she was not ready for this conversation. Not fully. And she needed to hold some of it at arm's length until she could sit down somewhere quiet and let it hit her at a sustainable speed. "That seems like a reasonable effort." "It wasn't enough." "You almost lost your arm tonight," she said. "Let's start there." Something crossed his face, not quite a smile, but adjacent. "Fair enough?" She checked the pressure bandaging on the fasciotomy sites. She checked the IV lines. She did the work of the next 20 minutes with the same focus she'd given the procedure, which was the only real skill she'd perfected over the past 4 years. The ability to put one thing down and pick up the next thing and keep moving. It was when she was standing at the documentation station, entering the procedure notes with the specific care of someone who understood exactly how significant this documentation was going to be, that she heard it. She heard it before she fully processed it. A change in the atmosphere of the ER, the particular shift of sound that happened when something with official weight entered the building. She looked up. Dr. Marcus Holt was in the corridor. He was standing with 2 men she didn't recognize. Not the federal agents, not hospital administration, but men with the specific look of lawyers or risk management, the kind of people who appeared in hospitals after events that needed to be shaped before they became a narrative. He was talking to them in the low, urgent register of someone explaining something that needed to be explained a certain way. He glanced up and saw her looking. Something crossed between them. Not a word, not a gesture. Just the specific awareness of 2 people who understood that whatever happened next was going to be determined by what had already happened, and that neither of them had finished figuring out what that meant for them. Holt looked away first. Mara turned back to the documentation. She entered every detail with precision. She used the exact clinical language that would be legible to a reviewing body. She documented the compartment pressure reading, the delta value, the procedure performed, the outcome. She documented the timeline. She documented that the attending had been present and that the procedure had been undertaken after clinical assessment indicated. Her screen went dark. Not the whole system, just her terminal. A targeted logout, the kind that happened when an administrator manually removed access. She looked at the screen, looked at her login credentials, which were no longer valid. She looked up at the nursing station supervisor, a woman named Darlene who had been at Riverside for 11 years and who Mara had always found reliable and fair-minded. Darlene was looking at her with an expression that said she had received a communication she wished she hadn't. "Darlene," Mara said, "I'm sorry, honey." And she genuinely was. "I got a directive from administration. Pending review of tonight's incident, your access has been suspended." The ER kept moving around her. Somewhere down the hall, a patient was being wheeled in. Equipment beeped. The storm kept battering the windows. Life doing what it always did, continuing regardless. Mara looked at the dark screen, at the documentation she had been halfway through entering, at the procedure notes that were now inaccessible in a system she'd been locked out of. She thought about 9 cases, about the folder on the table in the consultation room, about a mountain in a country she wasn't supposed to name, and a man who had died protecting an exit point that had been compromised before they ever reached it. She thought about the look on Holt's face when he turned away. She took her badge off her lanyard, set it on the counter next to the keyboard, picked up her personal phone from her locker, her jacket, her bag, the 3 things she'd walked in with 7 hours ago when the shift started and everything had been ordinary. She was in the main corridor, heading toward the exit, when Torres appeared around the corner. He was still in his scrubs, had clearly been moving quickly, and he stopped when he saw her. "They suspended your access," he said. "I know." "I'm going to file a formal objection," he said. "Part 2. What you did tonight." "Document the procedure clearly," she said. "Every step." what the pressure reading was, what the outcome was. Make sure your notes are filed and saved before anyone tells you not to. Torres stared at her. Are you leaving? She looked at him. He was young and he was good, and he'd made the right call tonight under significant pressure, and she thought he was going to be a very good physician, and none of that was something she had time to say properly. The patient needs monitoring every 30 minutes, she said. Don't let that slide. She walked toward the exit. The ER doors opened ahead of her, releasing the smell of rain and wet pavement and the particular cold of an Oregon night after a long storm. She stepped outside. She was standing under the ambulance bay overhang, just out of the rain, just far enough that she couldn't go back without making a decision about it, when her phone rang. Unknown number. Oregon area code. She answered. The voice on the other end was male, careful, and spoke with the clipped economy of someone accustomed to conveying a lot of information in a very short time. Nurse Sutton, he said. My name is Colonel Warren Briggs. I'm calling because Vivian Harmon asked me to reach you tonight. We have a situation developing inside Riverside General that I believe you should be aware of before you make any decisions about your next steps. The rain came down beyond the overhang. She watched it for a moment. What situation? She said. We've been running a quiet investigation into Dr. Marcus Holt for the past several months, Briggs said. The complaint Harmon mentioned to you. Tonight moved the timeline significantly. Our legal team is prepared to act. A pause. But there's a complication. What complication? The documentation of tonight's procedure. Holt's team has already filed an administrative motion to have it classified as an unauthorized intervention, which means the official record, as of right now, describes what happened in that trauma bay as an unsanctioned procedure performed by a suspended nurse, without noting the clinical evidence that justified it, without the pressure reading, without the outcome data. Mara was very still. They have the system access, Briggs continued, and you don't. If the documentation gets shaped in the next few hours without a countervailing record from an authorized source, it changes what tonight looks like. Another pause. Shorter. It changes what Holt looks like, and it changes what you look like. Inside the hospital, through the glass, she could see the corridor. She could see Torres at the nursing station, writing. She could see the light of the trauma bay further in. She could see at the far end of the hall 2 of the men who'd arrived with the lawyers, standing, waiting, watching. She looked at all of it. What do you need from me? She asked. Briggs said, get back inside. She went back inside. Not running. She didn't run. Running drew attention, and attention right now was the wrong currency. She walked with the specific purpose of someone who knew exactly where they were going and had already decided what they were going to do when they got there, which was only partially true. She knew where she was going. The rest of it she was building as she moved. The ER doors closed behind her and the rain cut off, and she was back inside the particular atmosphere of Riverside General at 11:40 p.m. Fluorescent and close and smelling of antiseptic and the specific human exhaustion of a long overnight shift. She scanned the corridor without stopping. The 2 men near the far end had not moved. Holt was no longer visible, which meant he was either in his office or in a room she couldn't see, which was worse than knowing exactly where he was. Torres was still at the nursing station. He looked up when she came back through the doors. She didn't stop moving, but she said, as she passed him, low and clear, Your procedure notes. Where are they? My session. They're in my session queue, not filed yet. System flagged it pending attending review. Pending whose review? He understood what she was asking. It auto-routes to the attending on record, he said, which right now is Holt, she said. He said nothing because there was nothing to say. She was already thinking through the architecture of the problem. Holt's documentation team had moved fast, which told her they'd been ready, or ready enough. The administrative suspension of her access had come within 20 minutes of the procedure ending, which was not the speed of improvisation. That was the speed of a pre-built response. A framework someone had put in place for exactly this category of event. A challenge to Holt's authority, an outcome that contradicted his assessment, a witness with enough clinical credibility to make the contradiction stick. He'd done this before. Of course he'd done this before. You didn't build a 9-case pattern of unnecessary procedures without also building the infrastructure to contain the aftermath. Your personal device, she said to Torres, still moving, Do you have the delta pressure reading documented anywhere outside the hospital system? He reached into his pocket, pulled out his phone. I photographed the manometer display, he said. Reflex. I do it on unusual presentations. That was the first genuinely good piece of news she'd had in the last 10 minutes. Don't delete it, she said. Don't send it anywhere. Don't tell anyone you have it except Harmon. She stopped walking, turned to face him fully. Agent Harmon. Federal credentials, dark jacket. Do you know who I mean? I saw her come in. Find her, Morris said. Right now, tonight, before the building empties out. Torres looked at her for a moment with the expression of a 28-year-old resident who had come to work tonight expecting a standard trauma shift and was now standing in the middle of something significantly larger than that. Okay, he said. He didn't ask for more context. She respected that. She moved toward the records office. The records office at Riverside General was a room that nobody thought about unless they needed it, which meant it had the specific anonymity of institutional infrastructure. Functional, unglamorous, staffed at this hour by a single overnight records technician named Gerald, who was 57 years old and had the air of a man who had long since made peace with being exactly where he was. He looked up when she came in. Nurse Sutton, he said, not unfriendly. Gerald? She moved to the terminal on the far side of the room. I need to print hard copy documentation of a procedure completed tonight. Case number, she gave him Rourke's admission number. Gerald looked at his screen. The look that crossed his face was the specific look of someone who had just found a flag on an account. There's an administrative hold on that file, he said. I know there is, she said, which is why I need the version that was autosaved to the system back up at the 20-minute mark, before the hold was placed. She looked at him steadily. The backup save is automatic, Gerald. It's not covered by an administrative hold unless the hold was placed within that window, which it wasn't. Check the timestamp. Gerald looked at his screen for a long moment. I'm not sure I should. I'm not asking you to override anything, she said. I'm asking you to tell me if a backup version of that file exists, and if it does, to print it under standard documentation protocol, which is your job. He looked at the screen again. His fingers moved slowly over the keyboard. There's a backup save, he said. Time-stamped 2214. Before the hold. Before the session routing had locked Torres's notes into Holt's review queue, the autosave had captured it at the 20-minute mark because that was what the system did. Dumb, automatic, blessedly indifferent to whatever administrative maneuvering came after. Print it, she said. Gerald printed it. She took the pages, 4 of them, including the manometer delta reading, the procedure timeline, the outcome data, and folded them precisely and put them inside her jacket. Her hands were steady. Her mind was already on the next step. She was almost to the door when Gerald said, behind her, Nurse Sutton. She stopped. I've been here 11 years, he said. He wasn't looking at her. He was looking at his screen, at whatever was on it, with the careful non-expression of someone speaking sideways. I've printed a lot of records in 11 years. Amended records, corrected records. A pause. Records that looked different from the ones that came before them in ways that I was never in a position to ask about. She turned around slowly. He still wasn't looking at her. I can't tell you anything, he said. That's not my place. But I will tell you that the backup system goes back 18 months, and it runs on a 20-minute cycle, and a person with the right question could find some interesting gaps between what's in the primary record and what's in the backup for certain cases. He finally looked up. His face was entirely neutral. If a person were to think about that, 18 months, 9 cases, gaps in the primary record. She looked at him for a moment. Thank you, Gerald, she said. Just doing my job, he said, and looked back at his screen. She walked out into the corridor, and she was 3 steps from the records room door when she heard it, the sound from the trauma bay, the sound that separated itself from the general noise of the department with the specific urgency of a monitor alarm. Not a warning tone, but the flat, sustained pitch of a cardiac event. Rourke. She was moving before she'd decided to move, which was the only honest thing about her sometimes. Her body still ran on different reflexes than her current life required. She covered the corridor in 8 seconds and came through the trauma bay door to a scene that was already in motion. Torres on one side of the gurney, the monitoring nurse hitting the code button, Park running in from the far door. Rourke's cardiac monitor was showing a rhythm she recognized and which turned her stomach. Ventricular tachycardia, fast and disorganized, the heart doing something with electricity that had nothing to do with pumping blood. VTAC, Torres said, already reaching for the defibrillator cart. No pulse, starting compressions. Hold, Mara said. Torres looked at her. Check lead placement first, she said, moving to the bedside. Right arm lead. It's off the skin. The adhesive failed. She looked at the monitor. Reattach and reassess before you shock him. 2 seconds while a nurse reattached the lead. The monitor resolved. Not VTAC. Sinus tachycardia with artifact from a displaced lead. Fast, stressed, but organized. His own heart, doing its own rhythm, fighting through a hard night. The room exhaled. Torres had already lowered the paddles. He closed his eyes for exactly 1 second, then opened them. Good catch, he said. Check the leads every 30 minutes, Mara said. Movement and sweat, they migrate. Don't let the monitor be the first thing that tells you. Rourke's eyes were open. He'd been conscious through all of it, which meant he'd heard the alarm, felt the response, understood what was happening with the particular clarity of a man who'd been close to dying often enough to recognize the specific air of a room that thought he was about to again. Still here, he said. His voice was rough but present. Still here, she confirmed. She was standing at the foot of his gurney when the trauma bay door opened again and Holt came in. He was not alone. He had one of the men she didn't recognize, the lawyers or risk management, she still wasn't sure. And behind them, Administrator Gail Prentice, who ran the operational side of Riverside General with the particular efficiency of someone who understood that her job was primarily to prevent situations exactly like this one from happening. Prentice was 50, sharp-faced, and she was looking at Mara with an expression that had too many things in it to read quickly. Nurse Sutton. Prentice's voice was careful, professionally, deliberately careful. You've been suspended pending administrative review. You should not be in this bay. The lead monitor on the patient just failed, Mara said. I corrected it. That's documented, she said. Ask Dr. Torres. Holt was looking at her the way he'd looked at her through the glass an hour ago. That recalculating look, running through his options, building and discarding scenarios at speed. He was good at it. He'd probably been good at it for a long time. Gail, he said, and his voice had returned to its full register, confident, measured, the voice of a man who expected rooms to organize around him. This nurse performed an unsanctioned procedure on my patient. She is currently in violation of her suspension. I need her removed from the premises. She identified a monitor failure, Torres said from across the gurney, in a patient your team was covering. Dr. Torres, the patient had a displaced lead. The monitor was reading artifact as VTAC. If she hadn't... He stopped. He looked at Holt. The documentation of that will reflect what happened. The room had the specific tension of people in positions of different power, all pulling in different directions, and not yet sure which direction would win. Then Harmon came through the door. She came in the way she'd come in the first time, without urgency, with that particular federal stillness, and with 2 of the men from her team behind her. She had a phone in one hand and a folded document in the other. She looked at Administrator Prentice. Miss Prentice, she said, I need the room. Prentice looked at Harmon's credentials. The calculation on her face was fast and specific. Institutional risk versus individual risk. The math of someone who had learned to read documents and the people holding them very quickly. Marcus, Prentice said, and her voice had changed, quietly but unmistakably changed. Let's step out. Holt looked at Harmon. His jaw was working again, that specific movement of controlled anger. This is my department, he said. It is, Harmon agreed, and we'll have a thorough conversation about it, outside. She looked at him with the same flat patience she'd had in the consultation room, the patience of someone who had prepared for this exact conversation and was not concerned about how it went. Holt looked at Mara. It was a long look. It had several things in it, but what sat closest to the surface was something she hadn't expected. Not the arrogance, not the anger, but underneath both of them, barely visible, something that looked like the specific fear of a man who has built something over a long time and can feel it beginning to come apart. He walked out. Prentice followed. The risk management men followed. Harmon looked at Torres and Park. I need you both to remain available. Someone from my team will take your statements. She looked at Rourke. Captain? A nod. Brief, formal, the acknowledgement of someone who'd known about him longer than tonight. Then she looked at Mara. The backup documentation, Mara said. She pulled the folded pages from her jacket. Record system. Autosave from before the administrative hold. She held them out. Harmon took them, looked at the timestamp, then looked at Mara with an expression that was not quite approval, that wasn't Harmon's language, but was a specific recognition. There's more, Mara said. The backup system goes back 18 months, 20-minute cycle. Gerald in records can pull it. Harmon said, Gerald who? He'll know what you mean when you ask. Harmon looked at the pages in her hand. She looked at Rourke on the gurney, at the arm that was supposed to have been amputated 2 hours ago and was instead lying bandaged and perfused beside him. 9 cases, Mara said quietly. At minimum, Harmon said, just as quietly. Mara nodded. She turned back to Rourke. She checked his pulse. Still there, still present. His color was marginally better. His eyes were tracking. You should sleep, she told him. Hard to sleep in a hospital, he said. I know, she said. Try anyway. She stepped away from the gurney toward the door. She needed air, or something close to air. Needed to stand somewhere that wasn't the inside of this building for 5 minutes while she processed the evening in sequential order because she'd been running on compressed instinct for the past 2 hours, and the human machinery required to do that was not built for sustained operation. She was almost through the door when Harmon said, behind her, Sergeant Sutton. Old rank, old name. She'd used it deliberately, and Mara knew why. She stopped, turned halfway. The record review, Harmon said. Rourke's petition. It's been sitting in a queue for 3 years because we needed something to reopen it formally. Something current. Something documented. She paused. Tonight qualifies. Mara looked at her. What does that mean? She said. Flat, careful, not yet allowing herself to feel the shape of whatever was coming. Harmon opened her mouth to answer, and then the radio on her team member's hip crackled, sharp and immediate. The voice on the other end clipped and without preamble. Agent Harmon, we have a problem. Holt's attorney just filed an emergency injunction. They're claiming the federal investigation is based on fabricated whistleblower testimony. They're naming a source. A pause. They're naming Rourke. The room went very still. They're saying Captain Rourke is not a trauma patient, the voice continued. They're claiming he entered this facility deliberately as part of a coordinated operation to manufacture evidence against Dr. Holt, and they have documentation they say proves it. Another pause, shorter. They're filing it as obstruction of justice, against Rourke and against Nurse Sutton. Harmon looked at the radio, then slowly at Mara. Mara looked back at her. 9 cases. A mountain in a country she wasn't supposed to name. A man who had spent 3 years trying to find her. An arm that was supposed to be gone and wasn't. A record room technician who'd been watching things happen for 11 years without being in a position to ask about them. And now this. How strong is their documentation? Harmon asked into the radio. The voice on the other end said, strong enough that a judge is looking at it right now. Strong enough that a judge is looking at it right now. Harmon lowered the radio. She didn't react visibly. Her face made no particular movement, but something in the quality of her stillness changed, the way still water changes when something has disturbed it beneath the surface. Mara was already thinking, not about herself, not yet. That reflex had been trained out of her in environments where thinking about yourself first was how you got everyone around you killed. She was thinking about the structure of the claim. Rourke entered deliberately as part of a coordinated operation. They would need documentation for that. Documentation that would have to predate tonight, predate his arrival at Riverside General, predate the transport from the airfield. Fabricated documentation moved fast, but fabricated documentation that could survive a federal judge's preliminary review in the middle of the night moved at a very specific speed. Where did they get the paperwork? She asked. Harmon looked at her. The injunction? Mara said. They're claiming Rourke's presence here tonight was coordinated. That's a specific claim. To file it tonight, they needed documentation that already existed. Something they could pull quickly. She paused. Holt's been building a defense file. That's what this is. He knew a complaint was coming, or suspected it, and he built a preemptive counter-narrative. The injunction isn't improvised. It's been waiting. Harmon's jaw moved slightly. Not agreement, not yet, but consideration. The airfield, Mara said, where they found him. Who called the transport? That's classified. Who called the transport, she said again, and there was something in her voice that didn't leave room for the classification argument. Not loudness, she didn't raise it, but a particular quality that Harmon, who had been in rooms with people trained at very high levels, recognized. The transport request originated from a private contractor operating under a DoD support contract, Harmon said slowly, which means the transport documentation goes through a specific administrative channel before it becomes an official military record. And that channel, Mara said. Harmon looked at her. Has a point of contact at this hospital, she said. For billing and coordination. Who? A beat. The trauma department billing liaison, Harmon said. Which reports to the trauma chief, Mara said. There it was. Not a wall collapsing, more like a single structural element being identified, the one that, once you found it, let you see how the whole thing had been holding together. Holt had access to Rourke's transport documentation before Rourke arrived, had access to the paperwork, the routing, the administrative trail, had enough of it to build a counter-narrative that could be filed tonight, quickly, with enough apparent substance to make a judge stop and look. It was actually elegant in the way that corrupt systems are occasionally elegant, layered and self-reinforcing and designed to be the thing that was already in place when you went looking. He knew Rourke was coming, Mara said. Not tonight specifically, but he knew it was a possibility because Rourke filed 3 petitions in my name, and any one of those petitions could have circled back through DoD administrative channels to a hospital that treats military transport cases. She looked at Harmon. How long has Rourke been on the watch list for this hospital's transport contract? Harmon picked up her phone. She made a call without answering Mara's question, stepping half out of the room, her voice dropping below audible. The call lasted 90 seconds. When she came back, her face had the look of someone who had just confirmed something they'd hoped not to confirm. 14 months, she said. 14 months. Long enough to build a file. Long enough to have documentation ready. Long enough to have watched Rourke's petitions move through the system and to have constructed, slowly and carefully, a version of reality in which Rourke was not a patient, but a plant. He can't make that injunction stick, Mara said. Not if we move faster than he is. We need the billing records, Harmon said. The transport coordination documents that went through Holt's department. If we can show his team accessed that file before tonight. Gerald, Mara said. Harmon looked at her. Records office. He said 18 months of backup data. Mara was already moving toward the door. Billing records route through the same backup system as clinical records. If Holt's team accessed Rourke's transport file before his arrival tonight, that access is logged. She didn't wait for Harmon to authorize it. She was already in the corridor. Behind her, she heard Harmon say to someone on her team, "Get me the hospital's IT administrator, now." Gerald was still at his desk. He looked up when Mara came back through the door, and whatever he saw on her face told him this was a different category of visit than the last one. "The billing records," she said. "Transport coordination files, last 18 months. Same backup system?" "Same system," he said. "If someone in the trauma department accessed a specific patient's transport file before that patient was admitted, before he came through the doors, that access would be logged?" Gerald looked at his screen. He typed something. Looked at what came back. His face did not change dramatically, but she had gotten good at reading the face of someone who was carefully managing what their face was doing. "Every access is time-stamped and user-tagged," he said. "That's been true since they updated the system 2 years ago." He paused. "A person looking at transport coordination logs for a case filed under a DoD routing number would need to explain why they were in that file before admission was processed. Can you pull it?" "I can pull the access log," he said. "The log itself isn't protected. It's system infrastructure." He pulled it. It took 4 minutes, and Mara stood behind him and watched the screen and did not breathe any faster than normal, which was something she had to actively manage. The access log for Rourke's transport file showed 2 entries before his 9:14 p.m. admission. The first was a routine billing system query at 7:52 p.m. A general routing check, the kind of automated system ping that happened when a transport was scheduled through the DoD channel. Nothing unusual. The second was a manual access, a specific user login, at 8:34 p.m., 40 minutes before Rourke arrived. The user tag attached to that access was Dr. Marcus Holt's administrative credential. Gerald looked at the screen. Then he looked at Mara. Then he pressed print before she asked him to. Harmon had the pages in her hand within 6 minutes. She read them standing in the corridor outside records, her team member holding a flashlight over her shoulder because the overhead fluorescent in that section had been flickering all night, and chose this moment to decide it was done. She read without expression, which meant she was reading very carefully. Then she made 3 phone calls in sequence, each lasting under 2 minutes. By the time she finished the third, the injunction was being challenged. Mara leaned against the wall and listened to the one-sided version of it she could hear, the clipped professional language of someone who knew how to move things through legal channels at speed. She watched the corridor. The 2 men who'd come with the lawyers were no longer visible, which could mean they'd left or could mean they'd moved somewhere less visible, and she wasn't sure which option she preferred. Park appeared from around the corner. He looked at her, then at Harmon, then back at her. "Torres found me," he said. He held up his phone. "I have photographs of every instrument reading from the procedure. I took them during." He said it with the slight defensiveness of someone who expected to be told that was unnecessary. "Habit. I take pictures during unusual presentations in case they're useful for case review." "It's useful," Mara said. He exhaled, then lower. "How bad is it?" She considered giving him the reassuring version. She was tired, and it would have been easier, and he was young enough that she felt the pull of wanting to give it to him. "It's complicated," she said, "but it's moving in the right direction." He nodded, sat down against the wall next to her, which she hadn't expected. He sat with the exhausted slump of a resident at hour 15 of a hard shift, and for a moment they were just 2 people leaning against a hospital wall at midnight, which was a more honest version of the night than most of what had happened in it. "What she did," he said. "The procedure. I've been in 3 different hospitals, 2 different residency programs. I've never seen anyone work like that." Mara looked at the ceiling. She said. He looked at her sideways. "You," he corrected without embarrassment. "Sorry, I do that. 3rd person when I'm processing." She almost laughed. Almost. "Get some food," she said. "You've been running on nothing for 2 hours." He didn't move. "Holt has friends on the hospital board," he said. 3 of them, at least. Whatever happens legally, the board review could still go his way. She'd been aware of that, had been sitting with it in a compartment she hadn't opened yet, because there was an ordering to these things, and you had to deal with them in sequence, or you dealt with none of them effectively. "One thing at a time," she said. Harmon came back. She looked at Park, then at Mara. "The injunction is being withdrawn," she said. "The judge reviewing it got our access log documentation, and the timeline doesn't hold." A pause. "Holt's attorney is apparently very unhappy." Park made a small, involuntary sound that was not quite a laugh. "The board," Mara said. Harmon nodded slowly. "That's the next conversation." "Yes, Asek." They found Holt in the physician's lounge. Not hiding. That wasn't his nature. He was sitting at the table with his attorney and administrator Prentice, and a man Mara now recognized as Raymond Coyle, who sat on the Riverside General Board of Directors and who had, she would learn later, been the person Holt had called within 15 minutes of Rourke's arrival. Coyle was 62 and built like someone who had played a sport seriously once and never entirely stopped moving through the world with that physical confidence. He was looking at the documents in front of him with the focused displeasure of a man whose evening had not gone the way he'd planned. Harmon entered the room ahead of Mara, which was deliberate and correct. Federal presence leading, setting the terms. Mara stood at the back of the room, near the door. She did not need to be at the front of this. The conversation that followed was not dramatic in the cinematic sense. It was bureaucratic and dense. and involved a lot of specific language about compliance timelines and documentation requests, and the word pursuant used more times than Mara had heard it in the past year. Holt's attorney objected to several things, was overruled on procedural grounds on 2 of them, and went silent after that with the concentrated stillness of someone reassessing their position in real time. What mattered was the shape of it. Harmon laid out the access log documentation. She laid out the backup clinical records showing the delta pressure reading and the procedure timeline. She laid out the photographs Torres and Park had taken on their personal devices, which existed entirely outside the hospital system and were therefore outside the scope of any administrative hold. And she laid out the beginning of the 18-month pattern. Not all of it, not yet, but enough. Enough cases, enough gaps between primary records and backup records. Enough to make Coyle stop looking at Holt's attorney and start looking at the documents themselves. At some point in the middle of it, Holt said, "This is harassment of a senior physician based on the word of a suspended nurse." It was the wrong thing to say. Not because it was untrue in terms of his intent, but because it was the last version of the argument he had, and using it in this room meant the room could hear how thin it had gotten. Coyle looked at him when he said it, just looked at him, the long, specific look of a man recalibrating. "Marcus," Coyle said, and the first name said everything about how the weight in the room had shifted. Holt's attorney put a hand on his arm. Holt went quiet. The suspension was formal by 12:40 a.m., not termination. That would take more process, more review, more of the institutional machinery grinding through its required steps. But suspension with immediate removal of clinical privileges, escorted from the building, credentials suspended pending investigation. Mara watched it happen from the back of the room. She did not feel what she'd thought she would feel. She'd expected something cleaner, saw satisfaction maybe, or the specific relief of a compressed thing finally releasing. What she actually felt was more complicated and less articulate. Something in the range of tired, something adjacent to the feeling she'd had coming down from the mountain 14 months into her service, when the mission was finished and her legs were barely working and she'd understood for the first time that getting there was not the same thing as being okay. Holt walked past her on his way out. He didn't look at her. She hadn't expected him to. His attorney walked behind him, already on the phone, already beginning the next phase of whatever this became for Marcus Holt, which would be its own long story and not one that was hers to follow. She found Rourke's room at 1:15 a.m. They'd moved him out of the trauma bay and into a monitored room on the surgical floor during the procedural part of the evening, while she'd been moving through records and corridors and rooms she wasn't supposed to be in. The room was dim. The monitors were quieter here. The same information, smaller sounds. He was awake. She'd half expected that. She sat in the chair beside the bed because standing felt unnecessary now, in a way that things hadn't felt unnecessary since 9:14 p.m. when the doors had opened and everything had started moving. She sat and she looked at the arm, the bandaging, the IV line, the careful architecture of what had been done to preserve what was still there. She did not have a way to say what she was thinking about it, which was fine. Some things didn't need to be said in words. Some things got understood in the looking. "Harmon told me," Rourke said. His voice had improved since the trauma bay. Still rough, but more consistent. "About the injunction. It's withdrawn. And Holt?" "Suspended." He was quiet for a moment. 9 cases, he said. "At minimum." She paused. "Gerald's pulling 18 months of records. It might be more." He let that sit for a moment. Then, "Who's Gerald?" "Someone who was waiting for someone to ask the right question," she said. He looked at her. The specific way he looked at her. Direct and without performance. The way she remembered from before. From a different context in a different country, in a different version of both their lives. Made something in her chest do something complicated that she chose not to examine too closely right now. "The petition," she said. 3 years. "Yeah. You should have—" She stopped, started again. "There were other ways to reach me." "I tried 2 of them," he said. "You'd covered your tracks pretty well." She had. She'd covered them deliberately, systematically, with the same attention to detail she gave everything that mattered. She'd chosen Caldwell specifically because it had no military infrastructure, no DoD contracts, no reason for anyone in uniform to end up in its emergency department. She'd chosen Riverside General because it was mid-sized and unglamorous, and the kind of place where a competent floor nurse could disappear into the work for years without anyone asking too many questions. She had underestimated the DoD transport contract. "I was running," she said. She said it plainly, without softening it, because 4 years into the running, she'd at least gotten honest enough with herself to call it what it was. "I know," he said. "It's not—" She stopped again. The thing she'd been about to say was something in the range of it wasn't just about Cass, which was true, and also the kind of truth that required more space than a hospital room at 1 in the morning. "It's complicated." "I know that too," he said. They sat in the particular quiet of people who have enough shared history that they don't need to fill space. "The petition," she said again. "If it's reopened, it will be." He said it without qualification, which was not arrogance but a different thing, the specific confidence of someone who had been working toward one outcome for long enough that they'd stopped having doubts about the direction. "What does that mean practically?" she said. He looked at her. "Practically, it means your separation record gets reviewed. The incident report gets corrected. The psychological grounds—" He stopped. They were applied to a set of facts that weren't true. A corrected record changes the classification. She knew what a corrected classification could mean. She knew it in the abstract, clinical way she knew most things about her own situation, with the part of her brain that processed facts efficiently and the part of her that actually lived in her own body carefully kept at some distance from each other. "Harmon mentioned a leadership role," she said. "Emergency trauma," he said. "There's a program, medical integration, military and civilian emergency protocols. They've been looking for someone who bridges both." He paused. "They've been looking for specifically you for about 8 months. Harmon didn't lead with it because she was trying to do this in the right order." Mara looked at her hands, at the bandage line visible above his blanket, at the room in general. "I don't know what I want yet," she said. "That's fine," he said. "It's not fine specifically. I've been not knowing what I want for 4 years. That's also fine." He shifted slightly, a movement that crossed his face as a wince he controlled quickly. "You don't have to decide anything tonight." "I know," she said, but she was already thinking about Gerald, about 18 months of backup records that were probably going to unfold into something larger than 9 cases, about Torres and Park and the documentation they'd taken on personal devices because their instincts had been better than their institution, about Bryn, who'd found her footing in a hard moment and hadn't lost it, about the specific shape of a problem that was bigger than one doctor and one hospital and one nurse who'd been managing to disappear into a floor shift for 4 years, about what it meant to be good at something in a place that didn't yet know you were good at it, about what it meant to stop running. She was sitting with all of that when her phone buzzed. She looked at the screen. "Harmon. A text, not a call. Need you in the records room. Gerald found something. You should see this before anyone else does." Mara stood. Rourke watched her. "Go," he said. She went. Gerald was at his desk when she came through the door, and he looked up with the face of a man who had found something he hadn't gone looking for and was not entirely sure what to do with it. Harmon was standing beside him, looking at his screen with an expression that had lost its characteristic neutrality and replaced it with something more specific. On the screen was not a billing record, not a clinical backup. It was an email thread, pulled from the administrative correspondence archive, which had its own backup system separate from the clinical one, a fact that Gerald had apparently remembered at some point in the last hour. The thread was between Holt and Coyle. Raymond Coyle, board member. The man who had been sitting in the physician's lounge looking at documents with the displeasure of someone whose evening had been disrupted. The thread went back 11 months. Mara read it standing up, quickly, the way she read things when she needed to absorb information fast without letting the weight of it slow her down. It took her 40 seconds. When she finished, she looked at Harmon. "Coyle knew," she said. It wasn't a question. "He didn't just know," Harmon said. Her voice was flat in a way that meant the flatness was doing significant work. She pointed at a specific line in the thread. "He referred cases." Mara looked at the line. Raymond Coyle had sent Marcus Holt 8 patient referrals over 11 months. 8 patients routed specifically to Holt's trauma unit from Coyle's network, a private healthcare brokerage that Coyle sat on the board of, separate from Riverside General, a conflict of interest that was almost certainly not disclosed in any of the governance documents. 8 referrals. 8 patients who had entered Marcus Holt's care through a channel that financially connected their care to Raymond Coyle. How many of the 9 cases? Mara said. Harmon looked at her. We're checking, she said. But initial cross-reference. She stopped, pointed at the screen again. 7 of the 9 confirmed cases were Coyle referrals. The room was quiet except for the humming of the backup server and Gerald's hands very carefully not moving anything on his keyboard. Mara looked at the thread. She looked at the dates. She looked at the gap between what the board had known and what the board had pretended not to know, and she understood, in the particular way of someone who had been in rooms where the truth was being managed, exactly what had been happening at Riverside General for the better part of a year. Holt had been performing unnecessary procedures. Coyle had been routing patients to him, and the board, or at least the part of the board that Coyle controlled, had been the structure that contained it, that processed the complaint review and returned the findings and made sure that nothing that should have landed ever quite did. 9 cases, maybe more. But also, Coyle had been in the building tonight, had been in the physician's lounge, had seen the documents Harmon laid out, had watched Holt's suspension proceed in front of him, and had said nothing. Not because he hadn't understood what it meant for him, but because saying anything would have made it worse. Mara looked at Harmon. He's still in the building, she said. Harmon had already picked up her phone. Harmon moved fast when she moved, which Mara had noted before, but now saw in its full operational expression. The phone call lasted 40 seconds, the instruction to her team member at the door lasted 10, and within 90 seconds of Mara saying he's still in the building, 2 of Harmon's people were in the corridor outside the physician's lounge, confirming that Raymond Coyle had not yet left. He was still at the table. Still with his own attorney now, the board member's version of Holt's attorney, older, more expensive, the kind of legal representation that got retained on annual contract rather than per incident. Coyle had the posture of a man who had decided to sit very still and wait for information before making his next move, which was the intelligent play, and also, as it turned out, too late. Mara did not go into the lounge for this one. That was Harmon's room, Harmon's process, and Mara understood the difference between the work that was hers and the work that belonged to someone else. She stood in the corridor with Gerald's printouts in her hand, the email thread, the referral cross-reference, the access logs that showed exactly when Coyle had known exactly what. And she listened to the sound of an institutional structure beginning to disassemble itself. It was not loud. That was the thing about these moments that nobody told you. The collapse of something corrupt was rarely loud. It sounded like low voices and the shuffle of papers and the specific silence of attorneys conferring. It sounded like the building doing its regular overnight work around the edges of something that was quietly ending. Torres found her in the corridor at 1:47 a.m. He looked like what he was, a resident at the end of a very long shift who had done several things tonight that he had not been trained for and was not entirely sure how to process. His scrub top had a small bloodstain near the left cuff from the procedure. His eyes had the particular clarity of someone who'd been running on adrenaline and was just beginning to feel the other side of it. Rourke's pressure is stable, he said, holding at 96 systolic, radial pulse strong bilaterally. Bilaterally. Both sides. The arm and the baseline. She let herself hear that word fully. Good, she said. Bryn's covering him until the floor nurse rotation at 3. He paused. She asked me to tell you she documented everything. Her notes are... She was very thorough. Good, Mara said again. He looked at the papers in her hand, at the corridor, at the lounge door where Harmon's people were stationed. Coyle, he said. Yes. He stood with that for a moment. I referred to him 3 months ago, he said. A patient. 41-year-old woman, shoulder injury. He said Holt was the best trauma surgeon in the Pacific Northwest. His face was doing something careful and controlled. She had a procedure she didn't need. Mara looked at him. I didn't know, he said. I know you didn't. That's not, he stopped. Knowing I didn't know doesn't actually make it better. No, it didn't. She understood that. She'd spent 4 years knowing she hadn't known what was going to happen on that mountain, and understanding that not knowing hadn't made Ryan Cass less dead, hadn't made the outcome different, hadn't given her the specific absolution she'd needed. Not knowing was not the same as not responsible, and the distance between those two things was where people like Torres, like her, had to figure out how to live. You know now, she said. That's what you do with it. He looked at her. He was 28 years old, and this was not a simple thing she was saying, and he was smart enough to know it, and he nodded anyway with the particular nod of someone filing something away, not for comfort, but for later use. What happens next? He asked. For you. She looked at the corridor, at the door of the lounge, at the long institutional hallway of Riverside General at 2 a.m, with its flickering overhead and its particular smell and its sounds of an overnight department that kept moving because it had to. I don't know yet, she said. Which was true. Which was, for the first time in 4 years, a truthful answer that did not feel like the beginning of a retreat. Coyle left the building at 2:23 a.m. under circumstances that were quiet in the institutional sense and not quiet in any other sense. His attorney had negotiated the terms of his cooperation in the preliminary federal inquiry with the speed of someone who understood that cooperation now was the only variable left under his control. He walked out through the main entrance rather than the ambulance bay, a small dignity that no one had denied him, and which nobody watching particularly begrudged him, because it was a long walk from the physician's lounge to the front doors, and it took him past the nursing station and the trauma bay and the corridor where he had, 11 months ago, begun routing patients to a man who was willing to operate on people who didn't need to be operated on. He didn't look at any of it. Mara watched him go from the far end of the corridor. She was not in his path. She had not positioned herself in his path because this was not that kind of story. The kind where the wronged party stands between the villain and the exit and delivers something. She had no interest in delivering anything to Raymond Coyle. She had interest in what he'd done being addressed, which was different, and that process had already begun and would continue without requiring her to be in his sightline. He passed the nursing station and Darlene, who was still there, because Darlene worked long shifts and the overnight didn't end until 7. Darlene did not look up from her screen, which was its own kind of statement. He went through the front doors and the night took him and Mara turned away before the doors finished closing. Harmon found her in the break room at 2:40. Mara had made coffee, not for the caffeine, which she didn't need, but because the act of making it was something to do with her hands, something ordinary and sequential in a night that had been neither. She was standing at the counter with a cup she hadn't started drinking when Harmon came in. Harmon looked at the coffee, looked at Mara. There's a cup, Mara said, gesturing. Harmon poured one, stood at the counter beside her, which was the first time in the entire evening that Harmon had stood beside her rather than across from her, and the spatial difference was notable in the way small things are notable when you've been paying attention all night. They drank in silence for a moment. Coyle's attorney has already been on the phone with our legal team, Harmon said. He's cooperating. He'll give us documentation of the referral arrangement, the financial structure, the board communications. She paused. He's going to try to frame it as Holt misleading him about clinical necessity. Was he misled? Mara asked. Harmon looked at her sideways. The email thread you found suggests he understood the arrangement very clearly, she said. But that's what the process is for. How long? The investigation? Months. The board review? Probably the same. Harmon turned her cup in her hands. Holt has a team of attorneys who will take this through every available channel before it resolves. That's how these things work. Mara knew how these things worked. She'd watched the institutional machinery of accountability move at its particular pace through her own separation process. The reviews, the timelines, the language of processes that were designed to be thorough and were also designed structurally to take a long time. The 9 patients, she said. Their cases will be reviewed. Some will have grounds for civil action. Harmon paused. They'll get answers. It won't undo what happened, but they'll know what happened and why, and they'll have recourse. Mara looked at her coffee. How many of them knew something was wrong? She said. Not quite a question, more like a thought she was having out loud. At the time, how many of them had a version of the thing I had, a sense that something wasn't right, and didn't have the standing to say so? Harmon looked at her for a moment. Probably most of them, she said, without softening it. That landed where it landed, and Mara let it land without trying to manage it. That was the part that didn't get resolved by access logs and email threads and suspended credentials. That was the part that was going to sit somewhere in the middle of all of this for a long time, unresolved, because some things could be corrected and some things could only be acknowledged, and the distance between those two categories was where the actual weight lived. The petition review, Mara said. My record. It's been formally reopened as of tonight, Harmon said. Briggs filed the paperwork when I called him from the corridor. She set down her cup. The review board convenes in 6 weeks. Given the amended incident report and the 3-unit testimonies that have been sitting in a classified queue for over 3 years, the outcome is... She stopped. I don't want to tell you it's guaranteed because nothing in these processes is guaranteed, but the picture is clear. 6 weeks. 4 years, and then 6 weeks. The leadership role, Mara said. The program is real, Harmon said. It's not a consolation offer. It's a specific gap that has been specifically identified, and you are the specific person they've been looking for to fill it. She looked at Mara with the directness that had been her consistent quality all night. It would mean coming back, not to military service, to a consultancy role, integrated with civilian emergency medicine, developing protocols for cases exactly like tonight's, teaching the recognition patterns, building the bridge between what you know and what civilian trauma departments currently can't see. Teaching, Mara said, among other things. She thought about Torres, watching her hands during the procedure with the focused attention of someone learning something they hadn't known they needed to know. She thought about Park, who had taken photographs by reflex because his instincts had been better than his context. She thought about Bryn, finding her footing in a hard moment and not losing it. She thought about the 9 patients and about the 41-year-old woman Torres had referred who'd had a procedure she hadn't needed, and about all the versions of that woman in all the rooms of all the hospitals where the bridge between what military medicine knew and what civilian medicine practiced hadn't yet been built. She thought about the specific gap, the one Harmon was naming, the one she'd been living on the wrong side of for 4 years. I need to think about it, she said. Of course, Harmon said. She picked up her cup and finished the last of the coffee and set it in the sink. But I'll tell you what I told Briggs when he asked me what I thought tonight demonstrated. She looked at Mara. I told him it demonstrated that the gap is real, and the cost of it is real, and the person who can close it was standing in a corridor holding a medication tray because she'd spent 4 years trying to make herself small enough that no one would ask her to be what she is. Mara said nothing. You can think about it, Harmon said. Take the 6 weeks. And she left the break room with the same efficiency she'd brought to every other part of the evening. Mara stood at the counter. Outside the window, a small one facing east, the sky had done something. She hadn't noticed it happening, which was how it always happened. Imperceptibly, incrementally, the darkness changing its quality so gradually that you only registered it when it had already shifted. The black had gone to a very deep blue. Not dawn yet. The hour before dawn, which had its own particular character, its own quality of held breath. She drank her coffee. She thought about Cass. Not the way she'd been thinking about him for 4 years. Not the version that ambushed her at 2 a.m. with his face at the moment she'd said go. Not the version that lived in the space between sleeping and waking and reminded her that she'd made a call and someone had died. She thought about him the way you think about someone when the story about how they died has been corrected. The same facts, but oriented differently, pointing in a different direction. He had died covering an exit point that had been compromised before they ever reached it. He had died because command had failed to communicate a breach. He had died doing the thing he'd been trained to do in a situation that had been made worse by decisions made above both their pay grades. He had not died because she said go. She had known somewhere, for a long time, that this was possible, had known it the way you know things you are not ready to know, at a distance, through glass, acknowledged in the abstract but not yet allowed to arrive fully. The amended report changed nothing about what had happened. Ryan Cass was still dead, and the mountain was still real, and the sound that came after she said go was still somewhere in her auditory memory and would probably stay there. But the story she'd been telling herself about what it meant, that story was wrong. Had been wrong for 4 years. And she'd built a life on top of it, a careful, compressed, disappearing life. A life designed to be unobtrusive enough that the wrong story wouldn't be tested by anyone asking her to use what she actually was. She finished the coffee. She washed the cup, set it on the rack, went back to find Rourke. The room was quieter at 3 a.m. than it had been at 1. The monitors had settled into their rhythm. Bryn had gone for the rotation handoff, and the floor nurse who'd taken over, a compact, efficient man named Aldous, who'd been doing this for 16 years and had the unflappable quality of the genuinely experienced, was at the station down the hall. Rourke was awake. He was always awake when she came in. She was starting to think he'd been awake the entire time and simply resting with his eyes closed between her visits. She sat in the chair. They had been in this configuration enough times tonight that it had its own established quality. The chair, the bedside, the monitors doing their patient arithmetic. Coil, he said. Being processed, she said. He nodded. He looked at the ceiling for a moment, then back at her. The petition, he said. When Harmon calls you, and she will call you in a few days with the formal process, say yes to the review. Oh, I already said yes, she said. Something moved through his face. Relief, mostly, but relief is rarely clean at 3 in the morning after a night like this one. And what she saw was the real version of it, complicated and slightly wrecked and genuine. The program, he said. I'm thinking about it. You'd be good at it. I know, she said. Not arrogance, just an honest acknowledgement of a true thing, which was something she'd been stingy about for 4 years and was going to try to stop being stingy about. He almost smiled. That's new, he said. Shut up, she said, and then she almost smiled too, which was also new, or new again. The version of herself that had existed before the mountain, before the wrong story, before 4 years of careful compression. They sat in quiet for a while. The good kind. Not the absence of things to say, but the presence of enough shared ground that silence was its own communication. 11 kilometers, she said eventually. What? That's what Harmon said. That you told her I carried you 11 kilometers. That's accurate. It was 9, she said. It was 9 kilometers. I remember because I counted. He looked at her. Then he said, I was unconscious for most of it. I know, which is why I'm telling you it was 9. He was quiet for a moment, then, why does it matter? She looked at him. Because the story of what happened on that mountain has been wrong for 4 years, she said. I'd like the parts that are correctable to be correct. He held her gaze. He understood what she was actually saying, which was not about the distance. 9 kilometers, he said. Noted. Thank you. Outside the window, the deep blue had shifted again, incrementally, the held breath hour moving toward something. The arm, she said. What about it? How does it feel? He was quiet for a moment, and she appreciated that he didn't immediately say fine, which would have been the reflex and would have been dishonest. He actually checked. She could see him doing it, the internal inventory of a man trying to give an accurate account. Numb, he said, from the elbow down. Torres said that'll improve over days, weeks, maybe. He's right, she said. The nerve compression will resolve. It won't be linear. Some days will feel better, and some will feel like you've gone backward. But it'll resolve. You've seen it before. I've seen it resolve before, she said. Yes. He looked at his arm, at the bandaging, the IV, the careful architecture of what had been preserved. Something crossed his face that she didn't try to name. It was too specific to him, too layered, the face of a man sitting with the knowledge that something that was supposed to be gone was still there. Thank you, he said. Just that. Not for the procedure specifically, not for tonight specifically, just the word, carrying everything it needed to carry. She looked at him. You filed 3 petitions, she said, over 3 years. For someone who disappeared. Yes. That's... She stopped, started again. That mattered. I didn't know it at the time, but it mattered. I know, he said. They sat until the monitors changed slightly in their sound, as they always did somewhere around 4 a.m. A circadian thing, not medical, just the ambient noise of the building settling into its deepest hour. Aldous appeared at the door, checked the vitals without entering, made a note, and disappeared again. Mara sat in the chair at the side of a hospital bed in Caldwell, Oregon, at 4 in the morning, and she let herself be where she was, not managing the moment, not compressing it, just in it. Dawn came in the way Oregon dawn comes in, not dramatically, not all at once, but in stages, the sky running through its spectrum in long, slow gradients that made the window a painting of itself. By 5:40, the eastern edge had gone genuinely light, and the room had shifted from artificial to something mixed, the monitor's glow diluted by the first real daylight. She had slept briefly, in the chair. Not much. An hour, maybe slightly more. The compressed sleep of someone trained to take what the situation offered and wake completely. When she came back to herself, Rourke was still asleep, his breathing even, the monitors holding their steady numbers. His color was better. Not good. Not yet. That was a longer project. But better in the specific way that meant the night had been survivable and the day would be different from it. She stood, stretched the particular complaint out of her back that chairs always left, and went to the window. Caldwell, in early morning. The rain had finally stopped somewhere around 3, and the streets below were wet and clean-looking in the way of things recently washed, the way of things that looked, from a sufficient height, like a fresh start, which she knew was a trick of perspective. The streets were the same streets, the buildings the same buildings. But she looked anyway because sometimes tricks of perspective were what you needed to get from one thing to the next. Her phone had 12 notifications, 3 from numbers she didn't recognize, 1 from Torres, radial pulse strung on both checks, documentation fully filed. Bryn and I both submitted written accounts to Harmon's team. 1 from a number with a Washington, D.C. area code that had left no message but whose location she recognized from the area code as the kind of number that would leave no message. 1 from Darlene. Administrator Prentice is requesting a meeting with you at 9 a.m. She says she would describe the tone as positive. She looked at the D.C. number for a moment. Colonel Warren Briggs, the man who'd told her to get back inside. She called him back. He answered on the second ring, which meant he'd been awake, which told her something about the night he'd also been having. Sergeant Sutton, he said. Briggs, she said. The petition has been formally reopened, he said. I'm not going to pretend that's a surprise to you. Harmon said you took it with equanimity. I took it with coffee, she said. A short pause. The review board date will be confirmed by end of week, he said. I want to be direct with you about my expectation, which is that the review will resolve in your favor, and that when it does, I'd like to have a conversation about the program Harmon outlined, in person, if you're willing. There's a team in Portland that's been doing preliminary work on the protocol integration, and they've been waiting for someone to lead the clinical side. Portland, 45 minutes from Caldwell, close enough that it wasn't disappearing, close enough that it was instead the opposite. How many hospitals? She said. In the initial program? 6. Pacific Northwest focus first, then a national rollout if the model works. He paused. The model will work. You don't know that yet. I know what I saw in the documentation from last night, he said. I know what Torres's statement describes. I know what a delta pressure reading of 22 means in the context of a patient who was 45 minutes from an unnecessary amputation. He was quiet for a moment. I know what 9 cases means and what it means that a suspended floor nurse with a covered-up service record was the one who broke them open. She looked at the window, at the wet streets below, at the sky doing its thing. In person, she said. Portland, after the review. Good, he said, with the efficiency of someone crossing an item off a list they'd been carrying for a while. My office will be in touch. He ended the call. She stood at the window for another few minutes. The city was waking up. She could see it from here, the gradual addition of movement to the streets, the first cars, the particular purposefulness of early morning in a place that had things to do. She had always found something stabilizing in that. the world insisting on its own continuity regardless of what any specific night had been. It had been the thing that got her through the worst of the 4 years, the basic fact of the world continuing around the edges of her own stopped life. The difference now was that she was thinking about joining it again, not hiding in its continuity, but actually entering it. That was new. The meeting with Administrator Prentice was at 9, and Mara spent the intervening hours doing the things that needed doing, checking on Rourke, who woke at 7 and ate breakfast with the appetite of someone making up for a very bad previous 24 hours, reviewing her own documentation with Gerald, who had come in for the day shift with the energy of a man who had done something meaningful the night before and was still metabolizing it, drinking more coffee, finding at some point that the hospital had a small shower room for overnight staff and using it, which made her feel approximately 40% more functional. Prentice met her in a conference room, not her office, which Mara had noted as a deliberate choice. Conference rooms were neutral ground, offices were power structures, and Prentice was communicating something about how she wanted this to go. She had the look of a woman who had spent the night being woken by phone calls and had arrived at morning with a particular clarity about what needed to happen next. "I owe you an apology," Prentice said, before anything else. Mara looked at her. "Not for the suspension. I didn't have complete information, and in that context, it was a defensible decision." She said it evenly, without self-flagellation and without deflection, which Mara appreciated. But for the environment that made it possible, for a department structure that allowed what happened last night to happen over 18 months. She folded her hands on the table. "I'm going to tell you that I didn't know, which is true. I'm not going to tell you that excuses it, because it doesn't." "No," Mara agreed. "It doesn't." Prentice looked at her. "Your suspension is lifted, effective immediately. Your access has been restored." A pause. "I'd like you to return to your position. I understand that may not be what you decide, given—" She gestured broadly at the shape of the last 12 hours. "But the position is there." "I appreciate that," Mara said. "And I want to know—" Prentice stopped, tried again. "I've been doing this for 14 years, running operations for hospitals. I've never seen anyone do what you did last night under those conditions. I want to know what I could do to create an environment where what you know doesn't have to be hidden. Where someone with your background doesn't spend 2 years on the overnight floor because it's the place they can disappear." It was an honest question. It deserved an honest answer. "You could start by looking at who your trauma chief talks to outside the hospital," Mara said, "and creating a pathway for clinical challenges that doesn't route through the person being challenged." She paused. "And you could learn what a delta pressure reading means. Not so you can run the test yourself. So you know to ask when someone else says you should." Prentice wrote something down. Mara had not expected that. The writing it down. "I'll be honest," Prentice said, looking up. "I don't think you're going to stay." "No," Mara said. "I don't think I am. But I'd like to think Riverside General learned something from last night that outlasts the people involved." Mara thought about Gerald, who had been watching things for 11 years and waiting for someone to ask the right question. She thought about Bryn, who had found her footing. She thought about Torres, who would be a very good physician, and Park, who would figure out how to live with his referred patient and come out the other side of it better for the reckoning. "I think it did," she said. "I think it's in the building." Gut. She said goodbye to Rourke at 11. Not the last goodbye, so she understood that, and so did he. But the goodbye that was specific to this configuration, this room, this particular morning after this particular night, which would not happen again. His arm was going to take months. The nerve recovery, the strength rebuilding, the adaptation to what had been damaged, even in what was preserved. That was a long, non-linear, frequently frustrating road, and she told him so directly because softening it would have been an insult to both of them. "I know," he said. "Physical therapy will feel pointless at first," she said. "Do it anyway." "I know. And—" She stopped. "And?" he said. "Nothing." She picked up her jacket from the chair. "Just do the physical therapy." He looked at her with the look she'd been receiving from him since 9:14 the previous evening, that direct, unperformative attention. "9 weeks ago," he said, "I found out your transfer to Caldwell had gone through a specific HR channel that I had access to through the petition process. I knew you were here for 8 weeks before the transport. She looked at him. I want you to know that I didn't engineer last night, he said. The airfield incident was real. The injury was real. I did not arrange to end up in your ER. I know, she said. You know. The injury was real, she said. I saw it. I know what manufactured looks like, and I know what real looks like. And what was on that gurney was real. She paused. But I wanted to hear you say it. He held her gaze. 9 kilometers, he said. 9, she confirmed. She walked out. She walked through the surgical floor corridor, past the nursing station where Aldous was finishing his charting, and raised a hand without looking up, which was its own form of acknowledgement. She walked to the elevator, down to the main floor, through the corridor that ran the length of the building from the surgical wing to the ER, the long institutional spine of Riverside General with its fluorescent overhead and its particular smell. She passed the trauma bay. The doors were open. The room had been reset, gurney repositioned, supplies restocked, the surfaces returned to their default configuration as if nothing had happened in them, which was how hospitals worked and always would because they had to. The next patient was already somewhere in the building and the room needed to be ready for them. She stopped and looked at it for a moment. Gurney 7 had a different patient in it now, a teenage boy with what looked like a wrist injury, his mother beside him, both of them looking at the resident who was examining him with the specific attention of people who were in a stressful situation and wanted someone they could trust. The resident was thorough and calm. The mother asked a question. The resident answered it directly without talking down. Mara watched that for a moment. Then she kept walking. Darlene was at the nursing station still, or again, it was impossible to tell with Darlene, who seemed to exist in the space of the station the way certain people exist in the spaces they inhabit for long enough that they become part of the architecture. "Prentice meeting?" Darlene asked, without looking up. "Done," Mara said. "And?" Mara stopped at the station. She looked at Darlene. "You've been here 11 years," she said. Darlene looked up. 12, actually. I told Holt 11 because he stopped listening after 10. "You documented last night carefully," Mara said. "Gerald told me. Your notes were part of what Harmon's team is working with." Darlene was quiet for a moment. "I've been documenting carefully for a while," she said. "Certain cases, certain patterns." She said it with the neutral directness of someone who had been making a record for reasons she'd hoped would eventually be useful. "Didn't know who to give it to. Didn't know if anyone would take it from me." 9 cases. The people who had seen it and waited for the right question. Gerald, Darlene, the unit members whose testimony had sat in a classified queue for 3 years. The institutional knowledge that existed in buildings, in the people who stayed and watched and documented carefully and waited. "Someone will come to you, sir," Mara said, "from Harmon's team. When they do, give them everything." "Already planned to," Darlene said and looked back at her screen. Mara walked to the main entrance. The doors opened and she stepped outside. The air was cold and completely clean, the kind of clean that only existed after sustained rain had been through, washing everything down to its elements. The sky was high and pale and moving, clouds traveling at speed from the west, and the pavement was still wet enough to reflect the light. She stood under the overhang for a moment, the same overhang she'd stood under at midnight when Briggs had called and told her to get back inside. She stood there and breathed. And then she did the thing she had not done in 4 years, which was to not move away from something, but toward it. She took out her phone and she found the Washington, D.C. number, and she sent a text to Briggs that said, "Portland. After the review, I'm in." She put the phone in her pocket. She looked at the sky, at the wet street, at the ordinary Wednesday morning of Caldwell, Oregon, doing what it did. The thing about running, and she had run well, had been genuinely excellent at it, had applied to it the same focused efficiency she applied to everything. Was that it worked? That was what nobody told you, or what you didn't let yourself hear when they did. Running worked. It kept you intact. It kept the wrong story from being tested. It kept the version of yourself that had been built for a different life from being asked to be that thing again in a context where you had no control over the outcome. The problem with running was that it also kept everything else out. It kept Torres from learning that procedure. It kept the 9 patients from having someone in the room who could read what was happening to them. It kept Rourke's petitions in a queue. It kept Gerald's 11, 12 years of careful documentation from finding the person who would ask the right question. It kept all the gaps open, all the bridges unbuilt, all the distance between what she knew and what the rooms she worked in could see. She had spent 4 years making herself small enough not to be asked. And last night a man had come through a door on a gurney, had turned his head, had found her face across a crowded trauma bay, and had told her that she was exactly the person he needed. She had been the person he needed because she had never stopped being what she was. Not through the 4 years, not through the wrong story, not through the overnight shifts and the careful invisibility and the life constructed around not being found. What she was had simply been waiting, the way certain things wait, patient, particular, and unwilling to become something else. She had always known this. She had just, finally, stopped running from it. The street in front of Riverside General was ordinary and wet and already filling with the morning's business. A delivery truck. 2 people with coffee cups. A woman walking a dog that stopped to inspect something on the sidewalk with the deep professional interest of dogs everywhere. Mara watched it for a moment. Then she walked toward the parking lot, toward her car, toward the day and whatever it held, and she did not look back at the building because she had never needed to look back to know what was behind her. She already knew.